Good morning, everyone. Today, we will explore the Marketing Information System, or MIS, and its crucial role in modern organizations. MIS is more than just a set of reports. It's a framework for collecting, organizing, analyzing, and distributing information that helps managers make better marketing decisions. Think of MIS as the central nervous system of marketing operations. Just as nerves transmit signals throughout the body to guide action, MIS gathers information from multiple sources to guide strategic and operational decisions. Example: a hospital MIS can track patient trends, analyze service demand, and help management decide whether to expand maternity services or add a new specialty clinic. Let's start by defining MIS and its main components. A marketing information system is designed to organize and distribute continuous, relevant information that supports marketing decision-making. MIS ensures that managers have timely access to accurate data rather than relying on guesswork. Core components of MIS: internal records, operational data from within the organization; marketing intelligence, systematic monitoring of external information, including competitors and market trends; marketing research, structured studies to answer specific questions; decision support system, DSS, computer-based tools that help managers analyze data and make informed decisions. Let's first examine the internal records, which are the foundation of MIS. Internal records are the organization's core operational data. These include sales, orders, prices, costs, inventory, receivables, and payables. Purpose: internal records help managers detect emerging problems or opportunities. For example, a sudden increase in cancellations may indicate a service quality issue. 3 key elements: registration to discharge cycle, patient volume information, data resource management. Let's take a closer look at each element, starting with the registration to discharge cycle. This cycle collects detailed patient data from admission to diagnosis to treatment to discharge. It includes information such as attending physician and nurse, length of stay, follow-up appointments. Increasingly, these records are computerized, which improves accuracy, speeds up access, and reduces errors. For example, a hospital can quickly see which patients require follow-up care or which departments have longer average stays, helping optimize resource allocation. Closely related to this is the patient volume information system. This system tracks inpatient and outpatient numbers. It allows management to monitor bed occupancy rates, are hospital beds being used efficiently, department efficiency, which units are over or underutilized, capacity utilization, when is expansion needed, demand forecasting, helps predict service needs and plan resource allocation. For example, if the emergency department consistently exceeds capacity, data may support adding urgent care units. To analyze this data effectively, organizations rely on data resource management systems. Data resource management ensures that organizational data is properly stored and structured for analysis and decision-making. Key concepts: databases, structured, logically organized records, for example, patient records, billing; operational data, daily data used for current operations; distributed data, collected from multiple locations; external data, information from outside sources; data warehouse, consolidated, cleaned, and cataloged data for strategic analysis; data mining, identifying patterns and relationships in large data sets to guide strategic decisions. For example, mining patient records might reveal that patients who miss appointments tend to live further from the clinic, suggesting mobile outreach could improve retention. Let's explore how data mining is applied in practice. Data mining extracts actionable insights from large data sets. Applications include market basket analysis, identifying service bundles patients often use together; root cause analysis, detecting causes of quality issues; patient retention strategies, preventing attrition and acquiring new segments; cross-selling opportunities, suggesting complementary services; accurate patient profiling, understanding demographics, behavior, and preferences; For example, if data shows that postnatal patients also frequently seek family planning services, hospitals can bundle these into a single care package. Beyond internal data, MIS also incorporates marketing intelligence from external sources. Marketing intelligence is the systematic collection and analysis of publicly available information about the market, customers, and competitors. Types of intelligence: defensive, avoid threats such as competitor price cuts. Offensive, identify opportunities like underserved patient segments. Passive, benchmark performance against industry standards. Purpose, enhance customer satisfaction, build effective marketing strategies, understand competitors and anticipate market changes, gain a competitive advantage. An essential part of intelligence is analyzing competitors. To stay competitive, organizations must answer, who are our competitors? What are their strategies, objectives, strengths, and weaknesses? How do they respond to market changes? Levels of competition. Brand level. Similar services at similar prices. Example, 2 private maternity clinics in the same town. Industry level. All providers offering the same type of service. Example, all fertility clinics in the region. Example, a hospital might adjust its maternity services if a competitor launches a new prenatal program with extended hours. Now that we understand competitors, let's look at sources of intelligence. Marketing intelligence draws from internal personnel, doctors, staff, and field agents, government data, population statistics, health trends, regulatory updates, media, news articles, advertisements, reports, competitors, websites, press releases, public reports, academic sources, journals, theses, and research. Example, a hospital may use government birth rate statistics to plan expansion of pediatric services. Gathering intelligence requires a well-designed system. To create an effective system, train staff to report intelligence regularly. Encourage supply chain partners to share insights. Maintain formal and informal communication channels. Use document and image processing tools for rapid circulation of intelligence. Example, a clinic could implement a digital dashboard where staff upload weekly observations about patient trends, referral patterns, and competitor promotions. Intelligence informs decisions, but sometimes managers need more structured research. Let's examine the marketing research process. Marketing research follows a systematic process. Define problem and research objectives, develop research plan, collect primary data, implement plan, collect, code, analyze data, interpret findings, and report. Example, a hospital studying why outpatient attendance has dropped may define the problem, plan surveys, collect data, analyze trends, and report actionable recommendations. Let's break down each step, starting with defining the problem. Managers identify the decision needs. Researchers design methods to obtain the right information. For example, a hospital wants to reduce cancellations. The problem is defined as what factors contribute to patient no-shows. This directs the research method and data collection. Next, the research plan and primary data collection. The plan determines specific data needs and collection methods. Primary data must be collected systematically, avoiding casual or unreliable methods. For example, structured patient surveys, follow-up calls, or observational studies can yield accurate insights into appointment adherence. Once data is collected, it must be analyzed and interpreted. Data is collected, processed, and analyzed using statistical and qualitative tools. Insights are translated into management decisions. For example, analysis may show that weekday morning slots have higher cancellations, prompting the hospital to reschedule appointments or offer reminders. Finally, these insights feed into a decision support system. A DSS is a computer-based interactive system. It supports strategic and operational decision-making by integrating data from MIS, intelligence, and research. For example, a hospital DSS can simulate resource allocation scenarios, helping managers decide whether to add new services, hire staff, or expand facilities.
By combining internal records, marketing intelligence, research, and DSS, MIS enables organizations to make evidence-based decisions and respond dynamically to market and patient needs.